mostly I'm saying that for Phil Guzzo's, benefit. Welcome to another edition of the Yamhill Leadership Roundtable. I believe it's Tuesday. A lot has happened in the last couple of days, and a lot's going to happen at 1:30. Hopefully nothing too extraordinary or out there at the governor's press conference. But we'll try to get some short updates from folks, and then we're going to see if we can do some screen sharing so that we can all watch at the same time, and you can provide comments in the chat feature too, which I thought might be more fun than just all of us leaving it to watch on our own. But feel free to also leave and watch on your own. So what I'd love to do is start with, I'm not going to start with a federal update because I don't want to call Stacy back to her chair right now. She probably needs to eat food. But I'd love to hear from Senator Roblin. What would you like to tell us today, and what would you like to tell people in the community?
Mostly, I guess I would say is that, last week we had hearings in all of our subcommittees of Ways and Means as we get ready for some future special session. This week, we are taking that public testimony and meeting with the tri-chairs of the committee to see if there are changes that need to be made based on public input over the last week. And then hopefully you'll see a new revised explanation of the budget rebalance that would come before we come to a special session. There are other committees meeting on the sideline. So we've got one working on policing, we've got one working on liability, we've got other kinds of groups going on that are trying to get materials together for a special session. It looks like the federal government may come up with another distribution of money, and I think there is a reluctance for us to go in and do the rebalance without knowing what that is, because it may make a difference with regard to where we're going to go with each of these budgets. So we're waiting on that one. So I anticipate that we will not be in for a special session within the first 2 weeks of the session. It could be as late as September, but I would expect it'll be sometime in late August that we actually get to meet and have those conversations. There is a lot of lobbying going on in conversations. I have been on the meetings with the governor's 47 people advisory group to restarting education, and you're going to hear that a little later from the governor, and we've been asked to not say anything about it until it comes out there, because it's better to have consistent communication with one voice. And I have really that came up a lot in the conversation, is that we need to be precise and we need to be consistent so that people really know what we're talking about. And I think that message came across pretty loud and clear, and the student voice on that committee continues to be a really important voice. There are a number of students from rural areas as well that are talking about how important it is for them to get back in, but they are also important members. They're all high school kids in taking care of family members and others so their families can work. So it is the fears and aspirations of those kids come across, and I really appreciate the input that has been in those meetings. So we're going to hear, I think, shortly from the governor on that one. But other than that, unless there's any questions, I think that's pretty much the update for now.
Thank you, Senator Roblin. Are there questions for Senator Roblin? All right, I've really appreciated reading the words of some of the student members as well that I've seen, at least in the Oregonian, I think, but some strong voices there. All right, thank you very much, Senator. Stacy, what would you like to, I totally blanked on doing here's everybody who's on this, so we're just gonna go for it. Stacy, what's new from Congress right now, and when will you have good news for us?
Well, okay, so the good news, I don't know, but the Senate Republicans did release their bill called the HEALS Act. There's some major differences between that and the HEROES Act, and I'll try not to, we're still sorting through it, but at this point, we have the HEROES Act that passed the House at about $3 trillion, and the HEALS Act has about $1 trillion. So lots of difference there, and there's going to be, a major reduction in money available. So both bills infuse money into the Paycheck Protection Program. Some of the key differences, though, are, let me look at my notes here. So, well, one of the similarities, so the $1,200 stimulus payment to folks that qualified last time is also part of the HEALS Act. I know we still have people who haven't received that first payment yet, despite being eligible, and we're still trying to work with the IRS where we can to get them to cooperate and help us out and get those payments out. The HEROES Act, as you know, extended the $600 a week UI benefit through the end of the year. The HEALS Act reduces that to $200 per week, and then that ends at the end of September and would then decrease to 70% of an individual's wages prior to what they were making before they lost their job. The HEROES Act has about almost $1 trillion in funding for states and local governments. And so it's about $500 billion that would go to local governments, including counties and municipalities directly. That's the HEROES Act. The HEALS Act does not provide any additional funding for state or local governments. The HEALS Act also, one of the big concerns we have about the HEALS Act also is that it doesn't include any additional protections for moratoriums on evictions, and it also doesn't include really any meaningful protections for student loan payers. HEALS Act and the HEROES Act both have funding for schools, substantial funding for schools. The one big difference is the HEALS Act ties that funding, at least 70% of that funding is dependent on whether the school opens for in-person education or not. So again, still kind of sorting through the details on that and how that works, but those are the key differences that I've noticed for now. The HEALS Act does, I know businesses were wanting liability protections, and the HEALS Act does include a liability shield, so a 5-year shield aimed at preventing businesses, universities, hospitals, et cetera, from being sued over coronavirus-related damages, except for in the case of like gross negligence. And then I don't know, and I know our chambers are wondering about PPP for chambers and 501c6s, and I haven't been able to get to that in the HEALS Act, so I'm not sure if that is in there or not. But as we move forward, Senator Merkley is still fighting for making sure that families, our schools, and the healthcare systems and our small businesses have the funding that we need to make it through this. Negotiations can start now in earnest, and there's a lot of pressure to get this done by Friday when that UI benefit ends. So I do think that we'll see something, but what that looks like, I don't know. They have the Senate Republicans have kind of the upper hand on the Senate side, and the House has the upper hand over there. So both have some leverage in negotiations, and we'll see how it plays out.
Okay, great. Thank you, Stacey. Joya, question?
Yeah, so do you think that was there anything in there on forgivable for idle loans? Anything on that? I know that July 11th, all of the money run out, and so some businesses that were eligible for the idle got shut out of any part of forgivable piece. And that's huge, hugely important to some businesses when it comes to the idle. So if you know anything on that, Stacey, thank you.
Thank you. I wasn't able to see yet if the HEALS Act has idle funding. I know HEROES Act has $10 billion for the idle funding, but I'll follow up and keep digging for that part of it.
Okay. Do you know if you got an idle loan, whether you would be retroactively re-entered into any kind of forgivable piece?
I don't know that yet. That's a good question, and something that we were asking SBA about.
Okay, and HEALS as in HEALS, correct?
Yeah.
Okay, good.
Not the foot.
No, I didn't think so, but thank you. Okay, good. Thanks.
I definitely had that in my brain too.
I just wanted to make sure I was spelling it right. Thank you.
Yeah.
The reconciliation bill will be like fists or something.
Right. Yeah.
Yeah. So my question is, what do you think the likelihood is of some movement from the HEALS towards HEROES?
I can only speculate right now. I mean, both sides have some leverage, and there is that pressure to get it done by Friday, which worked to our benefit last time a little bit in some of these aspects. So I don't know. I know Senator Merkley had kind of hypothesized that maybe we would find, you know, like a literal in the middle on some of these things, but we'll see.
Okay, thanks. I meant to. I know that there's differing opinions. I recognize that around the $600 a week, and at the same time in our community, I was looking for the present statistics. I think we're at about 10% unemployment in Yamhill County, which gets us around 6,000 to 8,000 people, and it's even if we just do the 600 a week times the 8,000 people, if we call it that, that's a hell of a lot of money coming into our community and straight into our local economy. And so I think of it as we're helping keep up a lot of folks, but we're also really injecting a lot of cash into the economy.
Yeah, no, definitely. And I know, again, there are concerns about that 600 a week, but we're hearing concerns now from folks who are a little bit worried with that 70% piece and requiring the state unemployment office to do, any more kind of calculations and anything additionally complicated than we've already made it. So that's definitely on our radar too.
Yeah, definitely. Okay, thank you for that update. Were there any more questions for Stacey? Are there any things you really want her to know since Mayor Cape isn't here to talk about water? Any of the other mayors can talk about water too.
And we'll know more about this in the next couple of days. Like I said, we're digging fast and hard. Yeah. So.
Okay, thank you very much. All right, can we go on? We haven't seen lately Mayor Rogers, so we'll move on to mayors and start with Mayor Rogers. Mayor Rogers, what would you like to tell people in the community and here on the call?
Right, greetings. Thank you, Casey. Thank you so much, Beth. Thank you for organizing the call, as always. Well, let's see. Well, with the new fiscal year, the city of Newburgh is hiring. So we're looking for an assistant city manager with a focus on human resources, a public works director, and a new position for us is something we're going to call economic health manager. So a position that will be out making contact with the business community, help through these trying times, but then hopefully we'll be able to fund it into the future, really to do business development and relationship building. So that's what I got at the moment. Otherwise, everybody keep wearing your masks, folks. That's what I got.
I know I feel kind of like naked without mine here right now, but I am on the farm, so. And the economic health, is that, are you seeking coronavirus relief fund reimbursement for that, or is that?
Yeah. We're going to start it off with CARES funding, we hope, and then go from there.
Okay, that sounds great. Any questions for Mayor Rogers today, or comments? Okay, thank you very much and welcome back. Mayor Witowski, what would you like to tell people today? And did you get the cleaning done that you needed to?
Yeah, I kind of put my 10-year-old in charge of getting her out, which she just did. So that's super cool that she's old enough to help. My 2-year-old decided right as I was bringing this call online to bathe in the applesauce that I just served her for lunch and also to wash our table with it. So that's super fun. Parenting's awesome and easy. I, of course, am really anxious to hear at 1:30 a little bit more about the metrics for returning to school. I'm anxious, like lots of us, to hear what the next federal package really looks like. As a city, we're looking at some more creative models for how we can apply some of our relief dollars. We're kind of eyeing a program that Willamina is using, where they have this Willabucks, and they're using some of that money so that their residents who've been negatively affected can get kind of vouchers that are good at their local businesses. The businesses turn those vouchers in, the city cuts a check and can use those dollars. So we're looking into that for the city of Dayton to see if we can't help. Of course, again, like the urban program, it helps both parties, both the residents who get these vouchers to help them access resources and services and goods, and also helps the businesses who can see a little bit of that activity spike. So that's what's going on in Dayton. I'll pass that on until we hit 1:30.
Dan, Band on the Run, how did it go?
Oh my gosh.
I was farming, sorry.
It was so good. We had all 9 bands showed up. They circulated through town. Our fire department fundraised $2,100 in donations for delivering meals from our downtown businesses to people's homes. There were kids glued to their windows to see the fire trucks go by, bringing everybody dinners. There were lots and lots of folks who, after the first band went by, they thought, oh, they'd missed it. And then the second band came by and they kind of moved to the front doors. And by the time the third band came by, they came outside. So we had a lot of folks out, outside. It was perfect weather, not too hot, but beautiful and clear and warm. It was really, really wonderful. We got a lot of positive feedback. It certainly wasn't, really a sense of normalcy per se, but it was a sense of community and connection while we all stood outside and, enjoyed the same bands, some minutes or hours apart. I also love, my social media feed, like some of yours, I would presume it has been pretty divisive or critical or a little negative lately. And it was really beautiful to have an evening where my social media feed blew up with, this is the view on 7th Street, this is the view on Church Street, this is what it looks like at Water Street, and it was an Elvis impersonator and bluegrass bands and country bands and gospel bands and everybody rolling through. The musicians had a wonderful time. Our residents had a wonderful time. It was productive. All of our restaurants sold out of their featured meals, so it was good for them. Our firefighters, like I said, they actually fundraised more than they do during their typical fundraiser year, about $600 more than they usually do. So it was really successful for pretty much all parties involved, which made me whoo at the end of the night. And kind of get a reminder, that all of the work that went into that was worth it. That it brought a really, really positive evening to our community that, quite honestly, really needed it. Really needed a little bit of joy. So it was really good. Thank you for asking about that.
It's so awesome. Thank you. And I was thinking about you the other day when I think I was moving irrigation pipe. And I was like, I'm so glad that Mayor Wojtowski and the crew, people who organized that, did it. So thank you. Another awesome mayor. So.
If you're on my Facebook, or if I can even make them public, I think, but I live streamed several of the bands. So if you want to experience what that looked like from my driveway, you can even watch that. And it was just really fun. It was really good.
Cool. Thank you very much. All right, Mayor Hill, what would you like to tell people today?
Thank you, Commissioner, and those are on the line and those are listening in. Not much more to report since last Friday, other than we had another Mac dine out and we had some heat. But again, we still have the 21 restaurants that are involved in that. And I went downtown and I could see that there were many people that were participating. That was on a Sunday evening that I went by. And that was probably the hottest day. It was probably around 90 when I went by. So many were working from that perspective. Again, Friday, and I'll just reiterate, since there are some new people on the line, that last Thursday evening we found out that we received the Biz Oregon grant for emergency business assistance, and that came in at the full amount of $100,000, which McMinnville will match. And we are looking that money is going to be used within the next 2 months. So there's going to be a pretty substantial turnaround. We'll be, as I said, targeting women and minority-owned businesses as well as sole proprietorships with that. And we're looking into, but we're feeling pretty comfortable that the McMinnville piece of that 100,000, we can get CARES funding on that, and then that will allow us to take the 100,000 and go for MISO assistance loans that could give us 400 to maybe 500,000 to help in emergency relief. And then this evening we have council meeting and a pretty light agenda. We're going to just be looking at code amendments for construction, building, and safety. So with that, I'll turn it over to others.
Great. Thank you very much, Mayor. Before I move on, are there any questions for Mayor Hill? Okay, thank you. Diane McLaren from Chemeketa Community College, what would you like to tell people in the community today and on the call?
Hello. Well, one thing I wanted to report was that I was on a call this morning with the presidents of all the community colleges, and the question was asked, how is enrollment for fall term? And everyone said enrollment is down for fall term compared to last year. And we had some hope that maybe the students that were planning to go to university would instead choose to go to community college. But I think there's so much uncertainty right now about how we're continuing on that we may see late enrollments, later people enrolling when things are a little more certain. But, it was not real good news to hear that enrollment's down.
Yeah, definitely. Okay, thank you for that update. Are there any questions for Diane McLaren today? All right, great. Thank you very much. I'm going to move on to Scott Cooper from MEDP. What would you like to tell people today?
Yeah, not anything really update, just to want to let people in the business community know that no matter where we are or where the next act takes us, that your business organizations in your community and our communities working every day for you, sometimes quietly behind the scenes, sometimes not so quietly behind the scenes, but we are efforting every single day to do what we can. So if we haven't reached out and you haven't heard from us, or you've got a message from us, please get back to us and talk to us. It's all we can do is learn, and it's our best way to help you. So thanks.
Yeah, thank you very much. I like the sometimes not so quietly. All right. Abhi Shastun from SEDCorp, what would you like to tell people today on the call and in the community, especially those business people, not so quietly?
Good afternoon. I apologize for joining this group late. It's always one of my favorite groups to join. So I echo what Scott at MEDP said. Thank you for saying that, Scott. Just a reminder that we are here to support the business community. However we can do that, please let us know. I do want to share again. There's a lot of groups that we all join to share updates, and I apologize if these are repeats, but I want to make sure that this group is aware of the fact that our regional efforts to secure funding for Business Direct grants have landed us a third round grant funding from Business Oregon through their round 3 funds. Our 3-county area, Marion, Polk, and Yamhill counties were awarded $684,500, which brings our grand total to just over $1.1 million for our regional efforts. That we were able to do that in part, at least because of the early commitment of Yamhill and Marion counties to release a grant program, which we used as a match. So again, I want to thank the Board of Commissioners in Yamhill County and Marion County and our partners who said, let's try to do this. I also want to extend our thanks to the representatives that are regularly on this call, and those of you who participate in the e-board specifically. I know that there was some work to get some additional funds released into that program, which make a huge difference for us. We also appreciate the recognition that at this point, those funds, the conditions that they had originally been issued with were preventing people from accessing them. So for example, some of the early state funding did not allow applicants to be eligible if they had received any CARES Act funding, which for some businesses may have looked like $1,000 in EIDL funds, which would have prevented them from having access to up to $25,000 from some of these state programs. So we appreciate the e-board recognizing that and making some adjustments to that funding. We also want to say thank you for your work in getting some more funding through the system. At this point, that regional effort, so the regional solutions team for our region, which is managed by Jody Christensen, is now putting together a needs list for EIDL funding. So we have been actively working, the board, I'm sorry if you already brought this up, Commissioner, but the Board of Commissioners met on Monday and put together kind of a county-specific list. We're also working with other partners and individual businesses to get that list populated with projects. There will be more to come on that, but essentially this is the region's effort to create a dynamic living list of projects so that we can be very responsive when these funding opportunities with very short timelines come in front of us. So that is the work that we're doing right now, and probably, as others have already shared, making that pivot towards supporting businesses in this longer term kind of reopening, recovery, and shift to business model. Thank you.
Thank you, Abhisha. That's right. There's the short-term stability, like let's keep everything going and stable at some level. And then there's that long-term recovery piece. And these are all projects that are looking at that long-term recovery piece, with perhaps the exception of the broadband expansion. Hopefully we can get that done a little faster. Okay, thank you very much. Joya Goodrum, what would you like to tell people today?
Hello, and thank you. Once again, like everyone else has said, love these calls, and so appreciate being invited to participate and share what's happening at the chamber. A couple of things. Lemonade Day is August 15th. I'm going to say it until August 15th, so the 14th will be the last day I'll mention it. If you are interested in Lemonade Day information, you can go to lemonadeday /McMinnville and learn all about our particular one here in Mac. We've got about 100 kids signed up. We have 30 bags left, and if you are interested in picking up a bag, I don't believe they're at the chamber office anymore. I think they are over on 3rd Street at the arcade. But if you have a question, just call the chamber office at 503-472-6196. I'd also like to say to please support your local businesses and your local economy by purchasing or eating out at a restaurant, or even getting takeout and bringing it home. You are supporting everything that happens in our local economy when you do that. You're supporting our small businesses, you're supporting their employers, you're supporting our tax base, our education, everything. So please support our local businesses. And lastly, the McMinnville Chamber recently signed on to the U.S. Chamber's Equity of Opportunity Initiative, which basically is looking at 4 different areas of equality and in the workplace, in owning a business and those kinds of things. And so there's more information at the U.S. Chamber Equity of Opportunity website. And that's all I have today. Thank you.
Great, thank you very much, Joya. And I wanted to respond to Joya's comments, but we're getting close to the, I know that the governor is always a little bit late, so we're probably good, but I'll hold off. Leslie Caldwell, what would you like to tell people in the community today? And to follow up with that like inspiring message from Joya.
Tough shoes to fill. Well, not too much news from us. Our parent organization, Travel Oregon, has been busy working with the governor's office on crafting new plans for travel restrictions, which may be announced today. My understanding it's going to address restrictions across state lines for hotspot states, and not sure what else that will look like. But basically, they've put their ad campaign on hold again, and August and September will be focused on just messaging to visitors how to travel safely in the state of Oregon, and trying to encourage Oregonians to be mindful of outdoor recreation overcapacity that seems to be occurring pretty heavily at this point. So that's kind of what we're looking at, following the lead up from Travel Oregon, and that's about all I have for now.
All right, great. Thank you very much, Leslie. Do we have any last comments before we try to do screen sharing? All right, I want to follow up on Mayor Wojtowski's comments about the divisiveness in news or in feeds and on social media. And I naively wrote a post the other day linking to all kinds of comments about the federal agents in downtown Portland, thinking that here was an issue that all Oregonians could get behind. And boy, was I naive. Just want to say that I thought that arrests without probable cause were something that we could all denounce, and apparently that was not true. So I will look for my own bands on the run moments from here on.
You know, Casey, just to add to that, we got a call from family members in Wyoming calling and asking if we were okay here in Newburgh. And I reassured them that the area in Portland was a couple blocks wide and it was an hour plus from us. So that's what happened. National news will do it though.
Yeah, one of my neighbors actually pulled in and asked me, he was going into downtown and asked me if it was safe to go in during the daytime. Yeah.
Can you see my screen? Is that popping up or no? Yeah, okay. I mean, is it on the right screen?
Right now, there's the seafood and steaks slideshow. Yeah.
I just wanted to make sure that it wasn't like showing my email or some weird thing, like I clicked the wrong window.
That's good to clarify. Maybe I should text Jody Christensen and be like, hey, when is she going to be on?
Did everybody have a chance to share?
I think everybody did. Yeah. So my understanding is the press conference will talk about the numbers that each county or school district is going to need to be watching, and public health authorities are going to be watching in anticipation of in-person classes, but I guess we'll see.
Oh, Commissioner, can you hear me? Mayor Rogers disappeared, but I wanted to, I'll tell him in a minute.
Are you ready, Dr. Dean? Are you ready? Okay. Good afternoon. Thank you all for joining us today. I'm here today to talk about school plans for the fall. I'm joined by Dr. Dean Seidlinger, our state epidemiologist, Colt Gill, Director of the Department of Education, and Miriam Calderon, Early Learning System Director for the state of Oregon. I have to tell you, closing schools in the spring was one of the most difficult decisions I have made during the pandemic. It was in the early days, which feels like a lifetime ago. As COVID-19 continues to impact both our urban and rural communities, it's been clear that this school year will not look like any other school year. Over the past few months, I've often said that my decisions are based on the advice of medical experts and using science and data as my guide. And frankly, sometimes the data can point in several directions at the same time. Schools are a good example of that. As the American Academy of Pediatrics has stated, there is clear evidence that children receiving instruction and support in school is far better for them academically. It fosters our students' social and emotional well-being, their overall health, and often their physical safety. And I know that most parents agree. Parents also know that this is a highly contagious virus. And when there are lots of COVID-19 cases spreading in the community, then the likelihood that the virus will spread at schools also increases. That's why the American Academy of Pediatrics is also clear that only with low rates of disease and with adequate safeguards in place should schools return to in-person instruction. Both of these things are true. Good schools improve health, and we need to be cautious so that schools don't become places where the virus spreads. In early June, the Oregon Department of Education and the Oregon Health Authority provided schools and communities with comprehensive guidance to help planning for the fall. This guidance has provided every local school with a blueprint to implement clear health and safety protocols. It also provides the flexibility for schools to choose in-person instruction, comprehensive distance learning, or a hybrid approach. The plan each public district adopts for the coming school year is and remains a local decision. And yet, in the time since then, the virus has continued to spread, and we must follow clear public health metrics to know when and where it is safe for school to convene inside school buildings. That is what we are announcing today. Dr. Seidlinger will detail the circumstances under which school districts will be allowed to choose in-person or hybrid learning for their local communities. He will also outline the markers for the spread of the disease that will require schools to change gears and shift to comprehensive distance learning. These requirements will give our public schools, private schools, and communities the opportunity to make sound decisions based on the latest science and health data. These requirements also provide reasonable allowances for our smallest rural schools, as well as allowances for in-person instruction for specific populations of students, such as our younger grades. Studies show that younger students, particularly those in kindergarten through third grade, kids under 10 years old, have lower rates of illness and transmission than other children, older children, and adults. Providing nurturing, in-person relationships and learning to our youngest children is absolutely critical to developing the reading and language skills and social development necessary for their long-term success. Overall, these requirements align the recommendations from both public health experts and educators. A few notes on how we landed on these metrics. First, and as always, health and safety serve as our North Star. We are taking a cautious and careful approach that protects public health, just as we have over the past 5 months in tackling this disease. Second, equity. Equity has to be at the forefront of our decision making. We know that our youngest children, our students of color, low-income students, and students experiencing disability have faced the greatest challenges accessing a high-quality education and in their learning and development. Many of our families have already faced disproportionate impacts since schools closed to in-person instruction and moved to distance learning. Let me be really clear. I am absolutely unwilling to lose an entire school year for any of our kids. A year that could be foundational to the lifelong opportunities for thousands of Oregon students. I will push, I will cajole, and I will demand nothing but excellence from our districts and our educators. But it is also incumbent on all of us, every community, to take every measure to slow the spread of this disease so that we can get our kids back into school as quickly as possible. We cannot let our kids down. These are truly all of our children. I certainly have confidence in our teachers, in our school staff, in our administrators, and in our district leaders. To help our school children achieve their dreams and to ensure that kids can access comprehensive distance learning, I'm releasing an additional $28 million to be distributed to public schools under my Emergency Education Relief Fund. This money may be used for mobile hotspots, computers and technology, online curriculum, and teacher training. Oregonians, we can do this. We can rise to the challenge. Thank you. And I'm now pleased to turn it over to Dr. Dean Seidlinger.
Thank you, Governor Brown. I'm Dr. Dean Seidlinger, the State Health Officer and State Epidemiologist here in Oregon. No matter what age, students need to be safe and healthy in order to learn. Learning is a lifelong factor that's key to the individual's good health. Educators and school staff need to be safe and healthy to provide students the instruction, counseling, meals, athletics, and other supports that enrich their lives and prepare them to thrive as grown members of our communities. Parents and guardians need to have confidence that they will not have to risk their children's health for the sake of their learning, or their learning for the sake of their health by sending kids back to school. They need to know how schools are taking the right steps to reduce the risk a child could contract COVID-19 and bring the virus home to vulnerable members of their family, whether that's grandparents or other relatives with underlying medical conditions. The COVID-19 pandemic has confronted all of us with hard choices. For families, superintendents, and educators, public health officials, it's this question: how do we keep our students on track in their education while protecting them from COVID-19 and shielding the broader community from an increased risk of wider outbreaks when schools reopen? So here's what we see when we look at the evidence. Students are harmed by lost instructional time. Distance learning cannot fully replace in-person instruction, especially for our youngest students. Distance learning can compound some systemic inequities that already exist in our educational system, particularly in our students of color who have disproportionate access to online resources. In-person instruction can increase COVID-19 transmission, and as we learn more about COVID-19, both our models and our real-world experience tell us that coronavirus cases and potentially hospitalizations may rise if schools reopen in high-prevalence communities where there is rampant community spread. But we also know that COVID-19 poses much less risk to younger students, with data suggesting that children under 10 get the virus at lower rates, get sick less often, and have less symptoms with COVID-19 than older individuals, and seem less able to transmit the virus than older children and adults. We know that some places have reopened schools safely. We can learn from Denmark, Germany, the Netherlands, and other countries that have reopened schools. They reopened schools cautiously and only when rates of new cases were low, testing was available, and that we had support for isolation of individuals with COVID-19 and self-quarantine available for contacts. So there's no simple statewide answer for Oregon. We need to get our students back to class, but how we do it depends on a number of important factors, like the prevalence of the virus, the availability of testing, the capacity of local healthcare system to provide quality care, and the readiness of our public health system to work with schools to contain any outbreaks that may occur. So Oregon public health officials have developed transparent, evidence-based metrics to help school boards and school districts make local decisions based on local conditions to determine how they can safely reopen school to in-person instruction. To do this successfully, there are 3 levels of metrics we're going to present. The first is a set of metrics that represents the level of disease that we'd like to see for return of in-person instruction, whether this be a hybrid model or full on-site learning. At the state level, we'd like to see the percentage of positive tests be at or below 5% in the preceding 7 days over 3 weeks. At the county level, we'd like to see COVID-19 cases drop below 10 per 100,000 in the population in the preceding 7 days. Again, we need to see a trend over 3 weeks of this decreased case circulation. And the percentage of positive tests in that county should also be at or below 5% during this time. There are 3 important exceptions if a school district cannot meet all these metrics. Schools will provide in-person education for students in kindergarten through 3rd grade. It's expected that these in-class options will be offered to the extent possible under their reopening plans. And here's why. Our younger students get the virus at lower rates, get less sick, and are less likely to transmit the virus. And these younger students need access to in-person education to build the literacy and numeracy skills that they need that are critical to their continued learning. Remote and rural school districts with less than 100 students and remote and rural private schools with less than 100 students may also offer on-site instruction. These rural communities often lack the online connectivity to effectively support distance learning, and by definition have small groups and smaller cohorts. School districts may also offer limited on-site instruction to students with disabilities or to support other educational needs. School districts should only prioritize these exceptions if COVID-19 is not actively circulating amongst the school community, the rate in their county where they're located is less than 30 cases per 100,000 in the previous week, over 3 weeks, their test positivity is at or below 5%, again over the previous 3 weeks, and that they comply with the guidance in the Ready Schools Safe Learners guidance that has been produced. But we know, as Governor Brown said, that opening schools to in-person instruction is not a one-way journey. If we see increasing cases in the community, it may be time for schools to consider moving back to comprehensive distance learning. So our second metrics provide some benchmarks for this. If we're seeing the case rate increase at 20 or higher per 100,000 in the previous 3 weeks, if we're seeing the test positivity rate go to 7.5% or higher, these are signs that schools should begin planning and communicating with families and educators about the potential need to move to comprehensive distance learning. And thirdly, if cases continue to rise at 30 per 100,000 or higher and test positivity rate goes to 10%, schools should consider moving to comprehensive distance learning with all but a few exceptions that we mentioned before. So today in Oregon, we are not where we need to be to safely reopen schools. Case rates over the last week were about 50 per 100,000 statewide. Our test positivity is approaching 5%. Our current case rates are higher than they need to be and are higher than they were in other countries when schools reopened. But we can suppress COVID-19 and return to levels where we can reopen schools. We did it before, we'll do it again. In May, Oregon's case rate fell to less than 1 new case per 100,000 people per day statewide. That's very close and lower than where many of our European and other countries safely reopened schools. At this time, Oregon's case rate was lower than that of many countries that safely reopened, and many counties are meeting this metric now. But we all have a role to play. Gather in small groups, keep your distance, and cover your face. We're seeing some glimmers of hope as more Oregonians follow this guidelines and Governor Brown's mask requirements. The total number of cases began to decrease in the last week. Our hospitalizations are leveling off, and our test positivity is declining. Our models indicate that transmission rates are beginning to decline, and we could even reach a point with continued cooperation of all Oregonians where the virus cannot reproduce enough to sustain itself at current levels. But we can't relent, especially as we all work together to get schools reopened and students back in desks. I want to thank you for everything you're doing as we fight back against COVID-19 in Oregon, and remember the activities you're taking, the actions you're taking right now help our students return to school and learn across Oregon. Governor Brown.
Thank you, Dr. Seidlinger. We appreciate your few notes of hope today. I'm going to turn it over to Director Calderon.
Thank you, Governor. I'm so pleased to join the Governor, Dr. Seidlinger, and Director Gill today. The decisions schools make related to early childhood special education, preschool, kindergarten through 3rd grade, and child care have important implications for the well-being of families, especially our most vulnerable, and the long-term success of our youngest Oregonians. Many experts at the national level, including the National Academy of Sciences, have recommended that schools prioritize in-person instruction at the elementary level when it is safe to do so. So far, our state is among few that are working to develop guidance to school districts about how to make that possible. This is because brain development in the earliest years of life lays a critical foundation that impacts children into adulthood. We know that brain development and learning in the earliest years occurs primarily through nurturing and responsive interactions with adults and other children. Young children are capable of working independently on activities, such as cutting with scissors, counting and sorting, practicing letter sounds, but deep learning for children in the earliest years, skills such as learning to read, requires a parent or a trusted adult there to support them for distance learning to be effective. Many families across Oregon will struggle to make that work. not because they don't want to, but likely because all available adults work jobs with less flexible schedules, they are essential workers, and/or their work requires them to leave their home. It is also true that some of the most meaningful learning that happens in early childhood education is about helping young children learn how to learn. Early educators are skilled at creating opportunities for young children to learn to work in groups, take turns, learn to pay attention on purpose. The less available in-person learning is for our youngest Oregonians, the increased likelihood that more children will miss out on these opportunities, and the more uncertainty and stress we will create for our families, especially for those who have been historically underserved. Throughout this emergency, slightly more than half of childcare facilities have stayed open to serve children and families in our state. Early childhood administrators and educators have been following increased safety and health requirements that mandate more hand washing, cleaning, limits on the number of children in care, and other changes and adjustments to business as usual. We've heard from families about the difficulties with balancing work responsibilities, caring and educating their children at home, and their concerns about whether childcare is safe for their children to return to. We've seen an incredible effort to support children and families by our child care providers and early education community. For that, we owe them a debt of gratitude. And we have also learned that there is no risk-free choice during a pandemic, and COVID-19 transmission has occurred in child care facilities. As we work to update our guidance for childcare and early education for this fall, the safety of adults that work in these programs remains a priority, and supporting them to implement the appropriate safety precautions to keep themselves, their staff, and the children in their care safe. And we all need to do our part to welcome young children back to school, preschool, and childcare as soon as it is safe to do so.
Thank you. Director Gill.
Thank you, Governor Brown. So I want to be really clear that our highest priority is to open our schools to in-person instruction for our students, and that we want each community to have the ability to do that as soon as we believe that they can provide safety and stability for our students, families, and the staff at each of our schools. We delivered the first version of our Ready Schools Safe Learner guidance back on June 10th. And there are three important facts that I want to clarify in that guidance. The first is that at the time we released the guidance, we believed most schools in Oregon would open this fall to some form of in-person instruction. From the data that Dr. Seidlinger shared with you today, you could see that at the time, most of Oregon was in a place within that level of community spread that would have been safe to open schools. The guidance reflected that stance. This also makes it clear that Oregon can return to these same lower rates of community spread that we enjoyed at the end of May and in early June. We can do that by wearing our face coverings, by maintaining physical distancing, by hand washing, and by limiting the group sizes of our gatherings. Second, we noted in that guidance that we were about 3 months into our COVID-19 experience in Oregon at that time. And we'd been learning a lot each week of those 3 months about how to respond to COVID-19. We also noted that on June 10th, we were about 3 months away from opening our schools in the fall, and that we knew that we would learn a lot each week this summer about how to deal with COVID-19 and where COVID-19 would be in the state of Oregon by the time school started. So we planned regular updates to this guidance. It's been updated on June 30th, July 22nd, and then today with this supplementary guidance. The next update comes in mid-August, and each of these updates reflect new stages of COVID-19 spread in Oregon, as well as new knowledge and efforts aimed at mitigating that spread. Finally, the guidance named that selecting an instructional model and opening to in-person instruction is a local school decision that should be based on a number of factors. First and foremost was local COVID-19 status. That remains true today. This supplementary guidance helps schools and districts understand their COVID-19 status so that they can open to in-person instruction as soon as community spread is at a level that makes it safe, and ensure that our schools don't become agents of further spread. Based on today's COVID-19 and test positivity rates, many schools in Oregon are preparing to open under comprehensive distance learning. This model of distance learning will look different than it did this spring. This spring, our schools had to close their doors to in-person instruction overnight. Schools, educators, and families rushed to put together the best supports possible on a tight timeline. Overnight, every teacher in Oregon became a first-year teacher as they tried to deliver instruction over entirely new platforms. This fall's comprehensive distance learning guidance has rigorous requirements for teacher training, family engagement, a common platform for students in each school, daily engagement between the educators and the students, social, emotional, and mental health supports, access to quality grade level curriculum, and assessment of student progress through Oregon's academic content standards. And importantly, equitable internet access and devices for each student. COVID-19 has highlighted inequities in Oregon. People of color and those in our rural communities have been disproportionately impacted by the illness and the economic challenges that it's created. The closure of schools to in-person instruction and move to distance learning in the spring had differential impacts on children and families. Some students were not fully able to participate due to a lack of a device or the inability to get online. Some students experiencing disability, and then younger students, as Director Calderon pointed out, had more difficulty fully participating in distance learning. As schools plan for the fall, using equity as a foundation for each decision is critical. As Oregon moves beyond an emergency response to now in a planned response for schools this fall, schools have an increased opportunity and responsibility to prioritize and target investments for students who have been historically underserved by our system and those impacted by the closures this spring. Schools can now plan ahead for comprehensive distance learning and directly focus on closing persistent gaps and inequities while maintaining high expectations for students and staff. Our guidance names these issues and provides recommendations, requirements, and resources to help, including equity-based decision trees, requirements to maintain access to school meals during distance learning, access to limited in-person instruction to support students who experience a disability, students who are emerging bilinguals, and other students with special learning needs. Also, provisions to provide in-person instruction for early literacy. And critically, state, business, and philanthropic partnerships to bring resources for technology into the hands of our students and educators. The $28 million in the CARES Act, the Governor's Fund, that Governor Brown talked about, will help ensure that we can provide more access and connectivity, that students and teachers have the devices they need to connect with one another from a distance. Digital content and curriculum will be up to par. Online learning management systems that will help students and their teachers connect with one another, and professional development for our teachers, as well as technology support for families. Partnerships with internet service providers and telecom can help provide Wi-Fi hotspots and more access, and donation programs from businesses will help get devices in the hands of our students. Our schools and educators will work hard to meet these needs and recognize and learn from the strengths of Oregon's students and families. We can do this well at a distance, but our collective goal is always to return to in-person instruction. We all, as Oregonians, have a part to play in that. Opening school to in-person instruction is not a one-way journey. If cases increase in local communities, schools will need to move back to comprehensive distance learning to further mitigate spread in that community. Widespread community commitment to physical distancing, to wearing your face coverings, to regular hand washing, and to limiting your group gatherings will help get us on a track to open our schools. The next 4 to 6 weeks can put us on that trajectory to opening schools to in-person instruction. This is what our students and families need, and we can all help achieve this goal. Thank you.
Thank you. I think, Charles, we're ready for questions.
Thanks everyone for calling in today. We'll get started with Lisa Balick from COIN. Go ahead, Lisa. Lisa, are you there? All right, we'll come back to Lisa and go to Pat Doris with KGW. Go ahead, Pat.
Yes, hi, thanks for taking my question. Governor, under your rules, it looks like Multnomah County would have to have about 81 cases per week, and last week we had 453 cases. How are we ever going to meet that metric?
Really good question, Pat. As you know, since we began the reopening process, we've seen a substantial increase in cases, not only in Multnomah County, but in communities around the state of Oregon. And I have taken some really strong steps, including requiring face coverings when in public spaces, limiting informal social gatherings to 10 and under, and also making sure we're limiting venue gatherings around the state. But honestly, the decision about whether our kids get back into school, whether it's in Multnomah County or Malheur County, is really up to each and every one of us as Oregonians. We can all play a role in stemming the spread of the virus. As Dr. Seidlinger and Director Gill have said, by maintaining your physical distance, by wearing your face covering, and continuing to wash your hands. We know we can do this, and it's up to all of us.
And then a quick follow-up, if I could. Are the districts required to follow these rules, or could individual school districts disregard them and do what they want?
Thanks. I'm going to have Director Gill respond to that question.
Yeah, thank you. These are a requirement, a directive that set a criteria for when schools can consider in-person instruction. Each community is different, and they will arrive at the decision once they meet the criteria about when and how to move into a hybrid model or an on-site model that may include more students every day. So there will be a transition, and each district is required to develop a transition plan moving both directions so that they can plan for a return to in-person instruction.
Thank you.
Thanks, Pat. We'll go next to Lachey Wesley with K2. Go ahead, Lachey.
Hi, thank you. So my question is, do any areas in the state currently meet these metrics? And Governor, are you prepared to introduce new restrictions in order to lower cases so schools can reopen?
In answer to your last question, as I've said before, all options are on the table to restrict the transmission of the virus. But it is really in the hands of Oregonians, and I'm asking Oregonians to take this very, very seriously. It's critically important for our kids to be in the classrooms, and if we can't enable that to happen in the short term, to ensure that they have access to good quality, comprehensive distance learning. And I will be pushing our school districts and our educators across the state to make sure that every child, regardless of where they live or who they are, has access to a good quality education. Dr. Seidlinger, her first question.
Thank you, Governor Brown. You know, while we are posting the data about the case rates per county and the percent positivities across counties so that individuals can look up and see where their communities stand. Right now, there's one county that would meet the criteria for reopening schools to in-person instruction, with the exception of our statewide positivity not being down for below 5% for 3 weeks. But we know that there are many more counties, about 13, that would meet the criteria under the exceptions to bring back in-person instruction for our kindergarten through third grade students who would most benefit from this instruction, as well as remote and rural schools in many counties that could meet these criteria. What we also see that's encouraging as we look at data in some of the other counties that haven't met this exception for kindergarten through third grade, that many are trending in the right direction. We're seeing case rates go down. I will call out Lincoln and Union County, for example, that were hard hit by large outbreaks with community spread throughout the month of June and have continued because of statewide action implemented by Governor Brown and actions taken by local officials, our public health response to bring case rates down, and are approaching where they need to be to bring education back. So no, not everyone is there, but many counties will meet this metric for some of the most vulnerable students, and I look forward to public health partnering with them to successfully bring these schools safely back onto campus.
Thanks, Lachey. We'll go next to Sarah Klein with the Associated Press. Go ahead, Sarah.
Hi, I had a couple questions. I know you guys were talking about the metrics. I was wondering if there's been more talks about what will happen inside the school. If students do go back, will they be tested? Will they be temperature checked before they go through the doors? Anything like that?
Thank you, Sarah. I know that the guidance that the Department of Education put out is 45 pages long, so it's quite extensive, and I'm going to turn that question over to Director Gill.
Thank you. So there is screening every day for students and staff as they return to our schools. So when we have school districts that can open to in-person instruction, or even when we have limited cases for the kindergarten through third grade that we're prioritizing, at the moment a student enters a school bus, at the moment they enter a building, they'll be screened for symptoms, and they'll be asked, families will be asked to affirm that the student doesn't have a temperature of above 100 degrees, 0.4. So there are those guidelines, plus a lot more around physical distancing. We require for kindergarten and up face coverings in most settings in schools. And we also have cohorts. So cohorts help us limit the number of students who would be impacted if there were an outbreak. So students are no longer interacting with all the other children in the school, but only with those students in their cohort.
Thank you.
Thank you.
Can I add?
Sure, please. Go ahead.
Just to add, Sarah, you asked specifically about testing. This is Dean Seidlinger with the Oregon Health Authority. I think while right now we don't have plans to test every staff member or student who returns to school, the safeguards we have in place and the metrics we have in place to reopen schools when community transmission is lower, I think serve as measures of safety for our school communities. As testing increases, particularly testing with quick turnaround, we will have the ability to respond to disease in these settings, and if needed, and if that testing capacity is there and the evidence shows it, to institute more testing of individuals when they arrive at schools. But right now, with the evidence we have and the resources we have put many measures and differing levels of safety in place to safely return staff and students to schools, focusing on those learners who will benefit the most and be least likely to spread the disease in those settings.
Thanks, Sarah. Up next, I think we've got Lisa Balick back from COIN. Go ahead, Lisa.
Yeah, hi, Charles, can you hear me?
Yes.
Yes, two questions. One, first for the governor. Instead of running the risk of having students go back to school, there's cases of COVID, then the school has to shut down, and they all have to go online, why not just say it's going to be all online until Christmas break and reassess then, to be able to have the teachers prepare in the next month or so for essentially what could be inevitable?
That's a really good question, Lisa. And the reason why I've been reluctant to move all of our education immediately and statewide to comprehensive distance learning or online learning is because not all of Oregon looks alike, and there are pockets and communities around the state of Oregon where we have relatively low virus rates, and so it makes sense to allow them to move forward with in-person education. But the second piece is there's a lot of kids who are going to struggle with online learning. And as I mentioned in my opening remarks, particularly kids kindergarten to third grade, it's really challenging to teach kids how to read online. It's hard to teach kids numbers online unless you have a skilled adult, a caring adult there present for the child. And so we think it's incredibly important to get these kids in the classroom as much as possible. my guideposts have been very, very clear. We're going to continue to work to make sure that our students, whether they're in classroom learning or through distance learning or some type of hybrid, can stay safe, that our teachers can stay safe, and of course that our professional staff can stay safe. And we're also very committed to making sure that every child gets access to a high quality education.
Quick question for Dr. Seidlinger. Follow up on the checks at the school door. Why not do temperature checks, since visually checking when a child is wearing a mask and there's nothing like measles showing on their face, what exactly would they be checking for, and why not do temperature checks?
Thank you for that question. I think when we look at the symptoms of COVID-19, not everyone has a fever, and particularly in our younger kids, they don't always have fevers. So we are asking parents to think about the symptoms that are consistent with COVID-19 that their child has had, and for individuals to do those checks at the door to try and prevent the introduction of COVID-19. But as we stated, one of the reasons for returning in-person instruction to our youngest children is because they're less likely to show symptoms, less likely to develop complications, and less likely to transmit the disease to others. So these checks are not going to pick up everyone who has COVID-19. Some individuals may not have symptoms, and that's why we're looking for decreased community spread before we allow this to happen. In our limited experience with COVID-19 and schools before schools closed in March, we did have cases associated with schools. Public health partnered with those schools, with those school districts and local officials to investigate those cases and to limit the spread in schools. We will continue to have a robust partnership between public health and schools. If a case is identified with a school, if more than one case is identified, we will investigate those cases. Right now, the adults and the children in schools are in smaller cohorts or groups, and so that we can identify who they had contact with, limit their contact, and do our investigations. If students and teachers and staff in that cohort need to go home because of exposures, it won't necessarily impact the whole school. So we will work together on this continued partnership to provide the safety that we need for all individuals in these school settings, and provide safety to their families that they return home to.
Thanks, Lisa. Next up, we have Rachel Monahan with Willamette Week. Go ahead, Rachel.
Hi, Governor. You mentioned that all of us have a part to play and that we can together bring down the number of cases. But of course, you're the governor, and I'm wondering what, if anything, you plan to do to bring the case count down in the next couple weeks so kids could go back to school.
Thanks, Rachel. As I've mentioned before, I've been very clear that all options are still on the table in terms of bringing the case rates down. We have taken numerous steps in the last couple of weeks. I am talking with other governors in western states to talk about what I would consider travel advisories to limit the number of folks that are traveling through Oregon. As you are probably aware, Oregon is basically surrounded by hotspot states, including California, Idaho. I think Washington's starting to cool off at this point in time. Obviously, I have other tools available to me, and we're working with medical experts through my medical advisory panel, and epidemiologists and physicians at the Oregon Health Authority will continue to make decisions based on science and data. And I'll make the decisions, the best decisions I can with the information I have in front of me at the time.
Quickly, do these criteria apply to private schools as well as public schools?
Yes.
Thank you.
Thanks, Rachel. Next up, we have Brenna Kelly from KPTV. Go ahead, Brenna.
Thanks. This question is for the governor. I wanted to ask about transportation to schools, and maybe this also can be for Colesville and buses. About a month ago, ODE said this was really the toughest challenge, or one of the toughest challenges, and it's one of the biggest topics on families' minds. I know there are updated guidelines in Ready Schools, Safe Learners surrounding health precautions like physical distancing. Can you
speak to the routing adjustments and basically how you'll get kids to school on time?
Thank you. That's a really good question. I just have to say, I know that this is going to be really challenging for our families across the state that have children in schools. This school year is not going to look like normal. It's not going to feel like normal. I know it's really challenging for our working parents in particular, the folks who are both caring for their kids and working outside the home. It's extremely challenging, and it's going to be really, really hard for kids. I know so many kids that are going to cry when they learn that they can't go to school like normal this year. And so I just want to say, I know this is hard. I know it's not going to look like normal. We are truly all in this together, and we're going to all have to work together to get the virus rates down so that we can get as many kids back into the classroom as quickly as possible. Director Gill, you want to talk a little bit about transportation?
Sure. Thank you. Transportation is a big issue, but it is like all of the challenges for Oregon schools, it looks very different community to community. So in Oregon, we have 197 school districts. About a dozen of those serve 10,000 or more students, and about a dozen of those serve fewer than 10 students. So you can imagine some of the rural parts of Oregon, there aren't as many students on a school bus necessarily, but they're there for a much longer period of time. In some of our towns in Oregon, those school buses are serving a number of students outside the city limits, and then they come in and they pick up several students who are actually within the walking zone of the school just to help out the family. And because a lot of our towns in Oregon don't necessarily have great sidewalks in the entire path from a student's home to their school. And then in our cities, many students are walkers, so they walk or bike or ride to school, and that's one of the things that we've been trying to promote in Oregon, both for student health. So we are going to, like Governor Brown said, we're all going to have to come together. We're going to need to make some sacrifices. Our transportation systems will be challenged. We only have a certain number of school buses and school bus drivers in Oregon. The school bus capacity will be reduced significantly when we implement physical distancing. The wearing of face coverings will help with that. Any kind of support that families can provide to help take their children to school will help reduce. And for each community, the routing of buses and the number of bus runs will look different district to district, and they will need to plan based on where students live and based on where the school is located and how safe it is to walk or bike or ride to school.
Thanks, Brenna. Next up, we have Eder Campuzano with the Oregonian. Go ahead, Eder.
Hello, can everyone hear me?
Yes.
I am. Can you hear me now? Beautiful, yes. Beautiful. So we're wondering, what has this statewide positive test rate been in each of the 3 previous weeks currently? And could you tell us what the most recent time at which Oregon's rate was at 5% or lower for 3 consecutive weeks?
Thank you, Eder. I'm going to turn that over to Dr. Seidlinger.
Sorry to step on you, Governor. I thought that was coming my way. When we look at the test positivity in Oregon, we've always had a fairly low test positivity. 3 weeks ago, it was close to 6%, and now it's down close to 5%. Our test positivity rate had been below 5% from the end of June, and that had started really at the beginning of April. So from April to the end of June, our test positivity rate was under 5%. We just recently came up above 5%, close to 6%, but again, we're trending back down. So I think that test positivity rate, if things continue the way they are, will continue to set our local communities up for successful reopening. And when we look at several counties, their test positivity rates meet that metric or going towards that metric. So I think we are in a good good place right now with testing supplies and constraints that can always change. You know that we've had many conversations about testing and our inability sometimes to get reagents or swabs or pipette tips. So we'll continue to do everything we can to bring those resources to Oregon so we can get test results back to clinicians, back to public health in a timely fashion.
Okay, and I wanted to actually also follow up on something you said earlier about, the school-specific, not outbreaks per se, but cases that were found in schools. I remember, having those first confirmed cases be, say, at a school in Lake Oswego, one in Hillsborough, and I'm wondering that under your guidelines here, if one school building per se were to account for a certain percentage of positive cases in a county, would you have a different, I guess, approach to addressing that at that particular school building versus having those measures move out to the rest of the county that that particular building is in, or is that a contingency that you are at all entertaining?
Yeah, so thank you for that question. I think, when we respond to cases of COVID-19 in Oregon or outbreaks of COVID-19 in Oregon, each situation is a little different. But let's talk about our response to COVID-19 in schools in Oregon. Every case of COVID-19 that's associated with a school will come to our public health attention. When we see 2 or more cases, we will work aggressively to find out who may have been exposed within the community, within households, and in particular within schools. That's one of the reasons why our Ready Schools Safe Learners guidance has really strong measures in there about limiting the size of groups that can gather or the cohort size. So if we see an adult staff member in school or a child who's attended school while they were potentially infectious, we'll work within that cohort size to identify who may have been exposed and to take appropriate public health actions to isolate those individuals who are sick or test positive and quarantine others who've had close contact. If we see that there's been exposure or even spread to other cohorts within that building, we would take additional actions for those other cohorts and may work on school-wide actions depending on the spread. Public health is used to working with our schools. They do it year-round for gastrointestinal illness and other respiratory illnesses. That partnership certainly increases every flu season as we identify cases associated with school. And while COVID-19 is a novel virus and seems to have more complications in particular subsets, those with underlying conditions and older adults, we can deal with this virus with many of the same tools we already have. Those plans were in place before COVID-19. Those plans have been enhanced with the Ready Schools Safe Learners, and we are currently developing increased guidance on how we respond to each case and each outbreak in schools to provide safety to the school community and the households they go back to.
Thanks, Senator. Next up, we have Natalie Pate with the Statesman Journal. Go ahead, Natalie.
Hi, Governor, you mentioned earlier that this does apply to both private and public schools. Can you clarify explicitly how this affects schools at youth correctional facilities and other specialty schools like the Shamawa Native American Boarding School in Salem?
Thank you. I'm going to turn that over to Director Gill.
Thank you, Natalie. Make sure I state this clearly. So the metrics that we're using at the county level remove the case counts for correctional facilities and detention facilities. So we're not including those in the community spread counts. And that's basically, and Dr. Seidlinger can speak to this more clearly, but that's basically because there hasn't been a tendency in Oregon for those to spread into the broader community. So there are clearly staff that move in and out of the facilities, but that hasn't caused community spread in Oregon. So the converse is also true. We're not going to use the county numbers to determine when it's time to open an educational program in one of our youth correction or juvenile detention facilities. We will use the case counts within the facility itself. And when that facility is safe for staff to re-enter, we want to include in-person instruction in those facilities. The guidance does apply to all of our private schools and public schools. We have boarding schools that are both private and public in Oregon, and it applies to them as well. There are more complexities with boarding schools as some of our students come from outside the state, come from outside the country, and closing down to in-person instruction in an emergency situation we found was challenging in the spring and could continue to be challenging this fall or through the school year. So we will work closely with each of those schools to ensure that there's a smooth transition if they have to move away from in-person instruction to distance learning.
Thank you. Dr. Seidlinger, do you want to add anything?
Thank you, Governor Brown, Director Gill. I think just to build on what Director Gill said, right now we are presenting the raw rates of cases in counties, but we know from previous experience our correctional facility outbreaks don't have significant spillover into community spread. So when we notice that counties are getting close to meeting the metrics for exceptions for K-3 students to come back, or for the full metrics to bring students back on campus, and if they're experiencing an outbreak in a correctional facility, we can remove those cases and recalculate the rate, because we want to set those schools up for success. And if the cases in the community aren't going to contribute to community spread or be at risk for spreading into the school, we don't want to count that against those students and those teachers who want to get back to school. The same thing if we see a limited outbreak in another setting that's contained. Again, we don't want to hold that against those schools as they try to reopen, so we will take those cases out and recalculate the rates. We want to reopen schools to in-person instruction safely, and we don't want to put hindrances in place that could stop that from happening.
Thanks, Natalie. We have time for just a few more questions, so I'm going to go next to Lauren Negretti with KVAL. Go ahead, Lauren.
Hi, thank you so much. Two questions. One about getting kids to keep masks on, the other Oregon graduation rate. So first off, what are the guidelines, if any, for teachers to get kids to understand to keep their masks on, to social distance when we look at these K through third graders?
Thanks, Lauren. Two things. I want to respond to the face coverings, and again, saying to parents and grandparents, aunts and uncles, people who are helping care for all of our children in the state. The reason why we issued the face covering policy when we did is we wanted to get our students prepared and ready to be wearing face coverings if they live in a district where they can go back to school. And so we think it's really important for parents to be working with their medical health professionals, make sure they're doing it right, make sure the mask fits and all that good stuff. So should the school doors open, kids are going to be really ready and wearing their face coverings. In terms of graduation rates, Lauren, I wasn't sure what your question was.
Right, and since then the state goal to improve the Oregon graduation rate, can that be achieved with hybrid, with distance learning as we look to this, like you're saying, this unnormal new normal?
Thank you, Lauren. My goal as governor is to make sure that every student graduates from high school with a plan for their future and the tools to be able to achieve, to succeed in this very global economy. We have made really solid strides forward in the last handful of years. Obviously, more work to do before we achieve that goal, that vision. And obviously, having the global pandemic, having the presence of COVID-19 in our communities around the state is going to be really challenging for a number of high school students. I do want to say thank you. I've had a couple of high school students on our Healthy Schools Reopening Council, and they have been extremely articulate, very passionate about the importance of in-person learning for many of their classmates, their friends, their colleagues. They understand that it's not just what you read in a book, what you learn from your teacher, but it's the socialization, it's the hands-on learning in a career and technical ed class that's critically important for many students across the state. I don't know, Director Gill, if you want to add anything to that?
Yeah, I do. If there's time to both of those, the face coverings, Governor Brown is exactly correct. So the more that families can practice with their children right now to help children feel comfortable wearing a face covering, wearing it for longer periods of time, each day as we get closer to opening a school to in-person instruction is really helpful. But outside of that, I would just want to share that our educators in our schools are experts at teaching routines to students. They do this all the time. So when students come to school, lining up is not a routine for them. Going down the hallway, walking is not a routine. Having a bathroom pass is not a routine that people typically have at home. So our schools and our educators know how to teach new routines to students and will help them get comfortable with it, and it will become normalized in that school setting. So I don't anticipate significant issues with the face coverings. I think our students will learn to understand why it is that they're wearing them, and it will just be a practice that is normal at schools when school comes around in the fall. And then as to the our goals around graduation rates, our graduation rates have increased significantly over the last 5 years, and my hope is that they continue to do so. I know that our educators at schools and our superintendents and school board members have all been driven around this goal to continually improve Oregon's graduation outcomes. These new challenges we have in how we deliver instruction will be challenging for us, but I know that our school districts have been working through the summer since before we even delivered the first set of guidance on June 10th to think about how they can provide professional learning for the teachers so that they understand how they can deliver in these new settings. We're going to be working with the State Board of Education this fall to allow for additional teacher professional learning time. In our instructional time requirements, we allow for 30 minutes of instructional or professional learning time, 30 hours of professional learning time a year for our teachers right now, and we're hoping to triple that so that we can ensure that our teachers are ready to teach under these new circumstances.
Thanks, Lauren. We're a little over time. We have time for just one more question. So we're going to go to Kaylee Turney with the Medford Mail Tribune. Go ahead, Kaylee.
Hi, thanks. I was curious whether a school that may not be able to reopen for in-person learning will be prohibited from participating in athletics come this fall.
Dr. Seidlinger.
Thank you for that question. I know as important as returning to in-person education is critical to our families, participation in athletics is also critical. That's one of the most popular topics I get in my email inbox with parents wanting to return to playing sports. What we have in place in Oregon is guidance that can allow that to safely happen. For most of our counties in phase 2, they're able to do recreational activities for all non-contact sports at a smaller gathering size. There are some particular restrictions in phase 1 counties that we have not moved forward because we've seen increased spread throughout the state and haven't added those additional activities. But we're refining our recreational sports guidance specific to K-12 so that we can have guidance to provide to schools as they reopen. We know OSAA, their counterparts in Washington, California, and other states have put out guidance around delaying some sports, and we certainly take that into account. What we want to do is get kids back to being active and playing competitive sports where it's safe. We know that right now we have some guidance in place to practice to scrimmage in all but contact sports, that it will likely be some time before we write guidance to safely return kids to contact sports. We've seen, whether it's professional, collegiate, or even adolescent and youth sports, we've seen spread in these settings, particularly amongst contact sports. We know that we won't be able to have schools compete with the broad array of communities across state lines, across communities as they did before, but we hope to be able to put some guidance in place that can allow for some of that limited competition so students, kids and their families can really benefit from that, and that guidance should be forthcoming.
I'll just close with Kaylee. My heart goes out to all the high school students who were working towards that letter or working on a team to achieve a championship this year. The sports year is going to look very different, just like the school year is, and I just know that participating in whether it's volleyball or don't know about football, but basketball, other activities are so important for our kids' emotional health. It's so important for their physical health, and I know that the sports activities are limited due to the virus, and that this is really challenging, not only for parents, but particularly for our student athletes that have been working so hard to achieve goals this school year. So with that, I will just close by encouraging Oregonians to help participate in getting the virus rates down by watching your physical distance, wearing your face covering, and of course washing your hands. I would certainly ask folks to keep their informal social gatherings way down to limit the spread, and of course to watch out for your family, your friends, and your community members. Thanks so much.
Well, thanks everybody. That was good to watch with you, especially because I got some comments into other folks here. I reached out to Superintendents Morlock and Russell for Friday to see if they can join us so that we can have a follow-up conversation with them, and the Director Lindsay Mann from Health and Human Services. So if you have the contact information for other superintendents, by all means invite them, and we can have a schools-focused roundtable. Any last comments? All right, well, thank you very much, Mayor, for getting us all set up so we could watch together. And everybody here works for you in the community. Reach out to us if you need something, and we'll see you on Friday.
Thank you very much.
Thank you.